Did you know that some of the medications sitting in your medicine cabinet right now might be silently increasing your risk of heart attack? For seniors already at higher risk of cardiovascular events, certain common prescriptions can be ticking time bombs. The worst part? Many doctors don't discuss these dangers when prescribing these medications. In today's video, we're revealing the 8 most common medications that could be putting your heart at risk, and more importantly, what you can do about it. This information could literally save your life. Before we begin, tell us in the comments where you're watching from and if you're currently taking any daily medications. And if you're new here, hit that subscribe button for more critical senior health information that your doctor might not be telling you. Let's start with a medication group that millions of seniors take daily: nonsteroidal anti-inflammatory drugs, or NSAIDs. These include over-the-counter medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and prescription-strength options like diclofenac and celecoxib, Celebrex. NSAIDs work by blocking enzymes called COX-1 and COX-2, which reduce inflammation and pain. However, this same mechanism increases the production of blood-clotting factors like thromboxane while reducing production of prostacyclin, which normally keeps your blood vessels open and flowing smoothly. Research published in the British Medical Journal found that NSAIDs can increase heart attack risk by up to 50% after just 1 week of regular use. For seniors with existing heart conditions, this risk is even higher because your cardiovascular system is already under strain. A typical 200 milligrams ibuprofen tablet taken 3 times daily can be enough to trigger these changes in your blood vessels. NSAIDs are also linked to sodium retention, which can raise blood pressure. Even a modest 5 to 10 millimeters of mercury increase in blood pressure significantly increases heart attack risk. The American Heart Association reports that about 70% of Americans over 65 already have hypertension, making this medication effect particularly dangerous. 1 standard dose of naproxen can cause your body to retain up to a half gram of sodium per day, about 20% of the recommended sodium limit for seniors with heart conditions. Regular NSAID use can worsen heart failure by reducing kidney function. Your kidneys help regulate fluid balance, and when they're compromised, fluid builds up, putting extra strain on your heart. Studies show seniors taking NSAIDs have a 10% increased risk of hospitalization for heart failure. Your heart must work 20 to 30% harder when excess fluid accumulates, which is particularly dangerous if you already have weakened heart function. So, how much is too much when it comes to NSAIDs? Generally, use the lowest effective dose for the shortest time possible. For chronic pain, discuss alternatives with your doctor rather than taking NSAIDs daily for more than 2 weeks. For seniors with existing heart conditions, acetaminophen, Tylenol may be a safer alternative for pain, though it won't help with inflammation. The highest risk appears in the first month of use, so if you must take NSAIDs, try to limit courses to less than 7 days when possible. The second category concerns medications some diabetic seniors might be taking, particularly older types of diabetes drugs like rosiglitazone, formerly marketed as Avandia, and some sulfonylureas. These medications affect how your body processes glucose, but they can also impact fluid retention and heart function. Rosiglitazone, before its restrictions, was found to increase heart attack risk by 43% according to FDA analysis. This increased risk occurs because these medications can cause your body to retain up to 1.5 liters of extra fluid, directly straining your heart. For a senior with even mild heart weakness, this additional fluid is equivalent to carrying around an extra 3 pounds constantly pressing on your cardiovascular system. Some diabetes medications like certain sulfonylureas, particularly older generations, can cause hypoglycemia, low blood sugar, which triggers a surge in stress hormones like adrenaline and cortisol. These hormones increase heart rate and blood pressure, potentially triggering cardiovascular events. A sudden drop to below 70 milligrams per deciliter blood glucose can increase heart rate by 20 to 30 beats per minute, creating dangerous strain. This is especially concerning for seniors, as hypoglycemia awareness decreases with age, meaning you might not recognize symptoms until your heart is already stressed. If you're taking diabetes medications, newer classes like SGLT2 inhibitors or GLP-1 receptor agonists generally have better cardiovascular safety profiles, and some even offer heart protection. Always take diabetes medications exactly as prescribed, at the same time daily, and with appropriate food if required. Monitor your blood sugar regularly to avoid dangerous fluctuations. If you experience symptoms like increased swelling in your ankles or unusual shortness of breath while on diabetes medications, contact your doctor immediately, as these could be signs of heart strain. The third category of concern is certain antidepressants, particularly older tricyclic antidepressants and some SSRIs, selective serotonin reuptake inhibitors. Tricyclic antidepressants like amitriptyline and nortriptyline affect multiple neurotransmitters, including norepinephrine, which can directly impact heart rhythm and blood pressure. Studies show these medications can prolong the QT interval, an electrical measurement of heart rhythm, by 10 to 15 milliseconds, which increases arrhythmia risk. For context, a QT prolongation of more than 20 milliseconds is considered clinically significant for heart rhythm disturbances. For seniors who already experience age-related changes in heart electrical conduction, this effect is particularly concerning, as your natural QT interval may already be 10 milliseconds longer than younger adults. Some SSRIs, particularly citalopram at higher doses, can also affect heart rhythm. The FDA recommends limiting citalopram to 20 milligrams daily for seniors, compared to 40 milligrams for younger adults, because of this risk. These medications can reach plasma concentrations 1.5 to 2 times higher in seniors compared to younger adults due to reduced metabolism, making standard doses potentially more dangerous for older individuals. Not all antidepressants carry the same risk. Newer options like sertraline, Zoloft, and escitalopram, Lexapro, show better cardiovascular safety profiles for most seniors. Depression itself increases heart attack risk by about 30%, so effective treatment remains important. It's about finding the right medication with the safest profile for your specific situation. If you're on a tricyclic antidepressant or high-dose SSRI and have heart concerns, never stop taking it abruptly. This can cause dangerous withdrawal and rebound effects. Instead, talk to your doctor about possibly switching to a more cardio-friendly option or adjusting your dosage. Many seniors do well on half the standard adult dose of antidepressants. Consider asking your doctor about regular EKG monitoring if you must remain on an antidepressant with known heart effects. The fourth medication category to be cautious about is COX-2 inhibitors, a specific type of anti-inflammatory that was once widely prescribed. COX-2 inhibitors like celecoxib, Celebrex, were developed to reduce the stomach irritation caused by traditional NSAIDs, but they brought unexpected heart risks. These medications selectively block the COX-2 enzyme while leaving COX-1 relatively untouched. This selective action creates an imbalance between thromboxane, which promotes clotting, and prostacyclin, which prevents it, potentially increasing clot formation risk by up to 300% with long-term use. For seniors with existing plaque buildup in arteries, this increased clotting tendency is particularly dangerous, as even a small clot can block an already narrowed artery. COX-2 inhibitors can raise blood pressure by an average of 3 to 5 millimeters of mercury. While this might seem small, research shows that each 2 millimeters of mercury increase in systolic blood pressure translates to a 7% increased risk of death from heart disease. For seniors who often have less flexible blood vessels due to age, this pressure increase affects you more significantly than younger adults. Long-term use of these medications can worsen kidney function. Your kidneys naturally filter about 200 quarts of blood daily, but this efficiency decreases by approximately 10% each decade after age 40. When COX-2 inhibitors reduce kidney blood flow by 10 to 20%, this compounds age-related kidney changes, potentially leading to fluid retention and increased heart strain. If you require a COX-2 inhibitor for conditions like arthritis, limit your dose to the minimum effective amount. For celecoxib, doses above 200 milligrams daily show significantly greater heart risk. Consider taking a drug holiday by working with your doctor to schedule periods when you stop the medication temporarily if your condition allows. Combining COX-2 inhibitors with certain blood pressure medications can worsen heart risks, so always ensure your doctor knows all medications you're taking. The fifth category may surprise you. Certain antibiotics, particularly fluoroquinolones like ciprofloxacin, Cipro, and levofloxacin, Levaquin, can pose heart risks. Fluoroquinolone antibiotics can affect the electrical activity of heart muscle cells by blocking what are called hERG potassium channels, which help regulate heart rhythm. This blockage can prolong the QT interval by an average of 5 to 15 milliseconds, potentially triggering dangerous heart rhythms like torsades de pointes. For seniors taking other medications that also affect heart rhythm, this risk compounds significantly. A standard 500 milligrams dose of levofloxacin achieves plasma concentrations that can affect heart cells within 1 to 2 hours of taking the medication. These antibiotics can also cause sudden drops in blood pressure in some individuals through a complex interaction with vascular tone regulators. Blood pressure drops of 20 to 30 millimeters of mercury have been reported, which can be especially dangerous for seniors with coronary artery disease who need consistent pressure to maintain heart muscle blood flow. If your doctor prescribes a fluoroquinolone antibiotic, ask if alternatives are available, especially if you have existing heart conditions or take other medications that affect heart rhythm. These antibiotics should be taken on an empty stomach or 2 hours after meals for proper absorption, but if you experience dizziness or palpitations after taking them, contact your doctor immediately. The risk is highest during the course of treatment and for about 10 days afterward, so be particularly vigilant during this period. Ironically, medications meant to treat digestive issues, particularly proton pump inhibitors, PPIs, like omeprazole Prilosec and esomeprazole Nexium, make our sixth category of concern. Long-term PPI use has been associated with reduced magnesium absorption, with studies showing up to 30% of regular users developing some degree of hypomagnesemia, low magnesium. Magnesium is crucial for heart function, with normal levels ranging from 1.7 to 2.2 milligrams per deciliter in blood. Even a slight drop below this range increases irregular heartbeat risk by 20 to 30%. Seniors already absorb dietary magnesium less efficiently, with absorption rates about 30% lower than younger adults, making this medication effect particularly problematic. PPIs can also affect how your body processes nitric oxide, a compound that helps blood vessels dilate properly. Research suggests long-term PPI users produce about 15 to 25% less nitric oxide, potentially contributing to vascular stiffness and increased blood pressure over time. Not all heartburn medications carry the same risk. H2 blockers like famotidine, Pepcid, generally show better cardiovascular safety profiles for long-term use, though they may not control symptoms as effectively as PPIs. If you need PPIs, consider them a short-term solution, 2 to 8 weeks, rather than a permanent fix. Many seniors can transition to H2 blockers for maintenance therapy. Don't stop PPIs abruptly, as this can cause rebound acid production. Work with your doctor on a gradual tapering schedule over 2 to 4 weeks. Consider having your magnesium levels checked if you've been on PPIs for more than a year, and discuss supplementation if levels are low. The seventh medication category to be cautious about is some rhythm control heart medications. Paradoxically, some medications prescribed to control heart rhythm problems can sometimes increase heart attack risk, particularly older antiarrhythmics like flecainide, propafenone, and certain others. These class IC antiarrhythmic drugs work by blocking sodium channels in heart cells, which can effectively control certain arrhythmias. However, in people with underlying coronary artery disease, they can occasionally make rhythm problems worse. The landmark CAST study found that these medications increased mortality in patients with previous heart attacks by 2.5 times compared to placebo. This occurs because these drugs can slow conduction in already damaged heart tissue by 30 to 40%, potentially creating new areas where abnormal rhythms can develop. These medications can sometimes cause what cardiologists call proarrhythmic effects, essentially causing new rhythm problems while treating existing ones. About 5 to 10% of seniors taking these medications experience some form of proarrhythmia, with the risk increasing significantly if you have structural heart disease or electrolyte imbalances. Many of these medications have what's called a narrow therapeutic window, meaning the difference between an effective dose and a toxic dose is relatively small. As we age, our liver and kidney function naturally decline by about 30 to 40% by age 80, meaning medications stay in our system longer and can reach higher concentrations than in younger adults. If you're prescribed rhythm control medications, regular monitoring is essential. This typically includes EKGs every 3 to 6 months and sometimes blood level testing for the medication. Never adjust the dose yourself, as both too much and too little can be dangerous. If you miss a dose, follow your doctor's specific instructions rather than doubling up. Tell your doctor immediately about any new symptoms like dizziness, fainting, chest pain, or palpitations while on these medications. Our final category concerns testosterone replacement therapy, which has become increasingly popular among older men. Testosterone supplements can increase red blood cell production, polycythemia, making blood thicker and more prone to clotting. Studies show that hematocrit, percentage of blood made up of red blood cells, increases by an average of 3 to 5% with testosterone therapy. When hematocrit exceeds 52%, clotting risk increases significantly, raising heart attack risk by approximately 30%. Testosterone therapy can also adversely affect cholesterol profiles in some men, particularly decreasing HDL, good, cholesterol by an average of 3 to 5 mg/dl. For senior men, who typically have more cardiovascular risk factors already, this change can be significant, as each 1 milligram per deciliter decrease in HDL is associated with a 2 to 3% increase in heart disease risk. It's worth noting that untreated low testosterone also carries health risks, including bone density loss, muscle weakness, and potentially metabolic issues. The key is proper monitoring and individualized treatment rather than avoiding therapy altogether if it's truly needed. If you're on testosterone therapy, ensure your doctor checks your complete blood count every 3 to 6 months to monitor for polycythemia. Different formulations, gel, injection, patch, have different risk profiles, with steady-release methods like gels typically causing fewer spikes in blood levels. Men with existing heart disease should have a thorough cardiac evaluation before starting testosterone and regular follow-ups afterward. The medications we've discussed today are often necessary for managing various health conditions, but understanding their potential heart risks is crucial for making informed decisions about your health. If you're currently taking any of these medications, don't panic and certainly don't stop taking them without consulting your doctor. Instead, use this information to have an informed conversation about whether they're the right choice for your specific situation and what monitoring might be appropriate. If you found this information valuable, please hit that like button. It helps more seniors find this potentially life-saving information. We'd also love to hear about your experiences with any of these medications in the comments below. What other medication concerns would you like us to address in future videos? Let us know in the comments section. Don't forget to subscribe to our channel for more critical health information that puts your well-being first. Remember, being informed is your best defense against preventable health risks. This is Senior Health Authority signing off with our motto, knowledge is the best medicine. See you in our next video.